Health data are an essential resource for the delivery of health services. Their capture, storage, and use are key to the care of the individual patient. In recent years, the combination of electronic patient records and being increasingly connected via technology have enabled the gathering, analysis, and sharing of health data at scale, leading to targeted development of new treatment pathways and health services. While recent developments in digital technology have been of great benefit to health providers, medical researchers, and to the public, the benefits have arguably emerged at some cost and risk to individual patients and to the public. Via interviews, we were able to discover people are willing to share their health data, but their motivations for doing so are different. Some felt it was an act of charity. I'm all for sharing my data if it means that it can help with the development of research or help other people in treatment. It's the hope that it would contribute to something being better for someone, somewhere. For others, their motivation arises out of a sense of duty, to give back to the NHS who have given so much to us. I think, well, the NHS has looked after me when I've been ill. I think I need to share information that helps any research that will help me and help other people in a similar condition. The public's willingness to share their health data is, however, dependent on moral principles. The interviews showed that respect for patient autonomy lies at the heart of their feelings. With a recent shift within the NHS towards presumed consent that now has patients responsible for opting out from data sharing rather than previously opting in, members of the public have expressed mixed feelings. There are clear benefits to the new structure, as it takes the effort away for those who would share their data but wouldn't necessarily go out of their way to complete the previous paperwork. I feel like it's a good model, because if you opt everybody in, people that would probably choose to do it but wouldn't necessarily go out of their way to go on and agree to doing it are involved, whereas the people that say no probably have a stronger opinion about the fact and therefore are more likely to just opt out, so I feel like it encourages more. For others, there was a sense of lack of individual patient control. You're left with a feeling it's not defined enough or time controlled in any way, that what you say yes to today is not necessarily what you agreed to tomorrow. The idea of truthfulness, in the sense of fostering understanding of what is happening with patient data in a digital context, was also important. It depends what the purposes are. I might never know. I'd want to know who it is being shared with and what the purpose was, so I'd want some assurance. It's a big leap of trust. As always, people are also concerned about their privacy. Some of the helplines that are run and gather data, you wouldn't want that to be shared any further than the team that are dealing with it, let alone linked into outside records. I guess so much of the research that involves medical records is going to be ending up with commercial organisations. They are getting monetary gain from it, but then it kept me alive. So I don't see a problem as long as my information is anonymised. This concern extended to governance issues and who has access to health data and how access to health data is obtained. If something has been anonymised, can it further down the line be identified? Trust in the anonymisation, whether we think that's credible or not. To some extent, I have to trust the NHS. Nowadays, of course, you're never quite sure whether anything that's anonymous is ever going to stay fully anonymous. Possibly the security measures that companies would have. Are they going to treat patient data with the same appropriateness as the NHS would? However, people's willingness to share their patient data for purposes beyond their own individual care and for the benefit of others was confirmed in our survey. If you were asked this series of questions, how would your answers compare with your family, friends, and colleagues? Do you agree that wider sharing of patient data can benefit the health of the population? 68% of the public agreed, or strongly agreed. However, the broader topic of the sharing of data beyond the NHS highlighted a degree of concern. Are you comfortable with your patient data being shared with organisations outside the NHS? 34% of the public were fairly or extremely uncomfortable about this, while 41% of people were fairly or extremely comfortable about it. Are you comfortable with your patient data being linked with organisations outside the NHS? 41% of the people said they were extremely uncomfortable about this, while 31% of people were fairly or extremely comfortable about it. After their data has been shared, we asked, How confident are you that local councils will handle your data responsibly? 37% were not confident their data would be handled responsibly by the council, but 26% did feel confident it would. How confident are you that commercial companies will handle your data responsibly? 44% answered they were not confident that commercial companies would handle their data responsibly, though 28% were confident they would. After listening to what the participants in our project had to say, we were able to draw these conclusions. The sharing of patient data should be handled in accordance with a number of moral principles. Beneficence on the one hand, but also respect for autonomy, truthfulness and privacy on the other. People are also more comfortable when they believe that the data is anonymised and securely governed. On the question of the sharing and linking of data beyond the organisational boundaries of the NHS and how these might be handled responsibly, our participants were, as the evidence suggests, more circumspect. Do the benefits outweigh the risks? From our survey, 81% think the benefits of patient data sharing outweigh the risks. What do you think? Let's talk.